kill you! Hey!
Whoa!
I guess this is what it would be like if I did have to give birth by myself.
Exactly.
Same thing. You drop me off and that's where I would be, I guess.
Yeah.
All right.
But I'm not sure.
Let's try this again.
Okay. Your eyes red, yeah.
Sleeping.
Can you scan that wristband one more time? All right. And then again, Mom, I'm just gonna get to your belly, okay?
Mhm.
So there's two monitor pieces that I'm gonna put on you. One is just for baby's heart rate, and then the other's for contractions, okay? So tell me what's bringing you in tonight.
Really sharp pains
Okay.
between like this part of my stomach and then sometimes shooting through my back into my butt.
Okay. When did they start?
Around 9 this morning,
Okay.
and they've been like on and off all day.
You don't have any like pressure or anything to where you feel like you need to push though?
When it shot through my butt,
Okay.
I did, but ooh, that's cool.
I know, sorry. You having a boy or a girl?
A girl?
Is this first baby?
No.
Which baby is this?
Fourth.
Fourth, okay.
2 boys, 2 girls.
Any history of like preterm deliveries?
Yes. My daughter was born at 36 weeks. My son 37, and then I had one 39.
Okay. All vaginal?
All that.
Okay. All right. And I'm just gonna put this other monitor on you, okay? And then in just a couple of minutes, Valerie will come in and she'll do your admission process. So about 30 minutes or so, just a few questions, some consents that we'll need you to sign. And then we'll take a look to see who's on for your provider tonight, okay?
Yes.
There you go. They aren't too tight, are they? Okay.
Blue is contractions, pink big heart rate.
Yes. Mm-hmm. Up here, though, it's going to look blue is baby, and then the contractions are that purple on the bottom. All right, well, we'll be back in just a moment, okay?
Thank you so much.
Anything you need when I come back in?
Just water.
Yeah. Do you want, I can fill this up for you right now. Do you want ice in it?
Yes, please.
All right, I'll be back, okay?
Thank you so much. I'm all hooked up to the monitors and everything like that. The nurse came in, and while she was in here, I had like 2 or 3 contractions that are being picked up on the monitor. So she said she's gonna call my doctor and see what the game plan is and then let me know. So when I know something, y'all will know something. But I am 34 weeks and I'm having contractions. So another nurse just came in and checked me. Good news, y'all. I'm not dilated. Baby is not even head down yet. They're gonna give me some fluids to try to get the contractions to stop. They offer for me to stay overnight, but I decided to go home. If I have to come back, I'll just come back. But they're also gonna give me morphine and what else was it? She said morphine and something else. Yeah. So they're gonna just monitor me, but not dilated. So that's a good thing. They're just trying to get the contractions to stop. So the doctor wants me to stay overnight and they want me to take this steroid shot for the baby to mature her lungs, just in case I do go into preterm labor. But also they told me that I'm not dilated any, so I just feel like it's no point in me getting the steroid shot. They are waiting to get my lab work back, my results back, to see what we're gonna do. I forgot to mention I declined the morphine and I declined the steroid shot for baby, and I also declined something else. It was 3 things. The steroid shot was for baby to mature her lungs, in case I go into preterm labor. But I just feel like I'm not going into labor, so I don't need to get the steroid shot. It would just be me getting it because I'm not in labor. I declined the morphine because I'm having contractions, but they're not like that bad. I have a few that are painful, but it's not to the point where I can't breathe through it. I'm trying to figure out why I'm having contractions, because if I don't have a UTI, which I forgot to mention, all my blood work came back fine. My platelets are low, but that's expected. And then I don't have a UTI, platelets are low, blood sugar is fine. So it's like everything is, blood pressure is fine, everything is normal-ish. So they're going to try to figure out why. I think the doctor's going to actually come and look at me and check me further to see why I'm having contractions. She said that at this point they wouldn't give me anything to stop the contractions because I'm past 34 weeks. I thought I was 34, but I guess I'm past 34. And she said this far along, if baby wants to go into labor or wants to come, they just let her come. So that's where we are. I've been here since 8 something. I think I updated y'all at like 9:45, 10. Then I updated y'all again at like 11, 12. Now it's about to be 1 o'clock in the morning. I was tired, if y'all couldn't tell by the last few clips. Okay, I just remember what that third thing was that I declined. Them wanting me to stay overnight. I told them I wanted to go home because they wanted me to stay overnight. They wanted to give me a shot of that steroid, wait 12 hours and give it to me again. But because I'm going home, they said I could just get it at my OBGYN appointment, which is this Friday, the 30th. Again, I would really love to go home, but the doctor has to come down and talk to me, give her recommendation, and we go from there. But if everything is normal, I just feel like, what's the point of me staying the night? If I'm gonna have contractions, I'm just gonna have them. And I'm not dilated, so I just feel like I'll just do this at home. Because if I stay overnight, what's gonna change? Nothing. Also, too, I just want to say, like, coming here tonight opened my eyes to potentially, like, what it will be like if or when I have to give birth by myself. It's lonely. Very, very lonely, and I'm not looking forward to it. I'm really not. But now I know what to expect. I know what to bring. I'm for sure bringing a pillow and a blanket next time I have to come up in here. I didn't bring that with my last 3 pregnancies, but I'm going to do it this time because I'm so uncomfortable in this bed, which is another reason why I want to go home. And then making sure I have my hospital backpack. I'm going to go ahead and do that this weekend. I need to get my hair done. So, this is just, tonight was just an eye-opener. The contractions is just, I need to get ready. Yep, I need to get ready. I need to stop playing, stop procrastinating, and just go ahead, pack my hospital bag, get my hair done. Just get ready because anything can happen, clearly. I mean, I knew that, but now I really know. And like I said, I'm just thinking about if I have to give birth by myself, this is what it's going to be like. And I was on FaceTime with Dion the whole time, but it's nothing like having him or someone in the room with you that knows you on a personal and deep level. My nurses have been great. Shout out to Danny and Valerie. I hope I have them when I come back to give birth because they are amazing. They took care of me for real. The care they gave me, the attention they gave me, I really, really appreciate it. And I hope I have either them when I give birth or nurses that are just like them, because this is about to be a lonely experience and I don't want to do it, but I have to, and I'm not looking forward to it. And I'm gonna just stop talking because I might start crying, so I'm gonna go. Okay, I know it's kind of dark, but the nurse just came in and drew my blood again. They want to check my platelets a second time. They want me to stay overnight. The doctor says she wants to make sure my contractions aren't getting closer together, because even though I'm not dilated, the fact that I'm having contractions and they're not mild, like they're kind of on the painful end, and they're actually like showing up on the monitor as like lengthy. She wants to make sure that they're not getting closer together, because if they are, that means I'm going into labor, dilated or not. If I do go into labor, I'm gonna be so mad because I don't have a phone charger. I have my iPad, but I'm using it. My phone's on 75%. My iPad is on 60%. I shit about my phone charger. Like, I don't know what I was thinking. Well, I guess I was thinking, like, they're going to check me, give me some medicine to stop the contractions, and I'm going to go home. I didn't think that I was going to be staying. And apparently, the doctor said that having contractions at this stage is normal, but not real contractions. Like, it's normal to have Braxton Hicks. But I don't know. I don't know what Miss Thing is doing in there, but listen, she got me going through it. Good morning. It's 5:48 in the morning. Next day, they just checked my blood sugar. It's 106, which is high for me, being that the last thing I ate was 8 p.m. the night before, or last night. So 106 is high. It's not too high, but it's high for me when it's usually like below 90. I did ask for something to eat because I am very hungry, very tired. Haven't had any more contractions. Well, I had small ones, but no, not the big ones that I was having. So the baby's heart rate, everything is fine with baby. My blood pressure and everything is fine. I don't know what my platelets results were. I had to get those for that second draw. I had to ask, but my nurse went to ask what the game plan was because they're about to do shift change in another hour and a half. So, I look terrible, but I just wanted to update y'all real quick. I'm so tired. I felt like my contractions stopped, but then like the longer I lay here, I feel them again. So I'm not really sure what's going on. I'm still having the sharp pains. I don't know. I don't know. Good morning, y'all, again. It's 8:25. I just got an update from the nurse. Basically, we are now waiting on a maternal fetal specialist and my hematologist because my platelets went from 73 to like 50, 52 or something like that in a matter of hours, and they need to figure out how to treat me. So they just bought me breakfast. You said baby is head down? Mm-hmm. Oh, I thought they told me she wasn't yesterday.
Heart rate's at a little excited, 168. Yep, head is right here.
Okay. That's a change from yesterday.
Baby move a lot?
Yeah.
This is baby's little waistline that I'm measuring here.
Okay.
A little bit of pressure. Trying to see that top of the head so I can measure it. As she's moving it.
There's a little thigh bone right here. Your baby is definitely on the run.
Mm-hmm.
Blood flow in the baby's cord, if I can get it. Really, just put your leg right in my picture. Okay. Let me come here. And there it goes. Got it. Woo-hoo. Just 2 more to get.
Okay. It says checking blood flow.
Taking the blood flow in the cord. That's from the placenta to the baby.
Okay.
Right. Got it. Heart rate's 147, so it came down just a little bit.
Okay.
So baby was just probably having what we call an acceleration.
Okay.
Just getting excited.
Is that her spine?
These are ribs here.
Oh, ribs. Okay.
And spine is down here.
Okay. Yeah, she wasn't head down last night, so that's a change.
That's a good thing. Let's see if baby will stay this way, right?
Yeah.
The nurse from the maternal fetal specialist, whatever, after she did the ultrasound, she told me that baby is almost 5 pounds. I think she said she was like 4 pounds 15 or something ounces, so she's about 5 pounds. And I'm just waiting on my hematologist, the maternal fetal specialist, and my OBGYN to talk and then decide what they're gonna do as far as treatment. I'm gonna be here well after 10 o'clock. It's now 9:35. They took my lunch order and my dinner order, so I guess they're anticipating me being here all day again. So that's the latest update I have. My phone 42%, my iPad on 42%. Dion said he'll bring me my phone charger, so we good on that.
Come in.
I think I got some people for you.
Yes, I can hear her. Hi. Hi, buddy.
Dion and the kids just left. The doctor from maternal fetal specialist came in and talked to me and just let me know that he's going to recheck my platelets. If they are at the same, he's going to send me home. If they are dropped, then they got to figure out what to do. But so far, they're just going to recheck my platelets and then see what the number is and go from there. He did say that even though baby is weighing about 5 pounds, they measure baby's stomach or waist area, and that's pretty much what they go by. Baby is measuring smaller and is at risk of fetal growth restriction, FGR. And if that's the case, risk for stillborn goes up and all these other things. So the only way they will induce me or have me give birth is if my platelets are further dropping, because if they get 30 and below, I'm at risk of bleeding in my brain or, somewhere else. And that's what what his concern is. Outside of that, he just feels like I should be going to hematology as normal and just treating the low platelets. But if they're still dropping, then we have an issue. And there's talks about maybe delivering now at 34 weeks. But then the issue, again, is the fetal growth restriction, FGR. So when they get my platelet count back, I will keep y'all posted. It's about 2:30 now. So they're going to check my blood sugar as well. They already drew the blood for my platelets. So I should be having those results around 3 o'clock. So as y'all see, I'm on my way home.
Okay, we gonna get milk.
But I got to tell y'all a funny story. So I left with this. So now we got to turn back around and they got to go and take it out. I called them and Dion was like, tell them I'll take it out. And she was like, legally we can't do that because you can bleed out. Dion like, legalities have left the building. Like, I'm already out. He was like, I'll take it out. She's like, no, you can't do that. You might bleed out, blah, blah, blah. And Dion's just like, but I'm already gone. So,
You saving her job.
but Dion said I'm saving my nurse's job because
It's just fun. It's all right.
I could sue them. I ain't doing all that. But yeah, gotta go back. We just went back, got the IV taken out. And when I was in there, they gave me this like certificate of appreciation. They were like, they had 2 ladies come out and, oh, Miss Gardner, we're so sorry. We thank you for coming back. I'm like, all I could think about is Dion. Because the lady kept on saying, tell your husband we are so sorry. We heard him in the background. Tell him we appreciate him so much for coming back. And now all I could think about was what Dion said. They worried about a lawsuit. That's what's going on. I'm like, he right. A certificate of appreciation, and it's going to give me a pack of free diapers? Oh, it says a substantial supply of diapers. So
That's what they got, right?
that's what this certificate say. I'm sure going to use it. Thank you for leaving the IV in my arm. And thank you for this appreciation. I'm not suing y'all. Y'all ain't got to worry about that.